what have you seen and how has it affected you?
Personally, it's just the weirdest situation. I never thought I would see a pandemic like this in my lifetime. I'm about 11 years out of residency now. So I'm sort of hitting a mid stride in my career and personally. So, to see this right now has been really scary, frustrating, anxiety provoking, also empowering in some ways. We see the resurgence in our career field of emergency medicine, which has been interesting with frontline work. I think it's really been a challenge, I think, for a lot of folks, not really me in terms of social distancing. I'm fine. I like Zoom parties. I like me a good Zoom happy hour. So that's cool with me. But I think things that have affected me differently, like I've never been really afraid before in terms of walking into a patient room. And so having to, one, acknowledge that fear and anxiety, and then also make sure that I have a good practice of how I put on my PPE and take it off, and ensuring that all the T's are crossed and the I's are dotted. I mean, so once you get that routine down, it gets a little bit easier to accept. I would say, the first month or so, the first couple of weeks were tough. I mean, definitely, it was scary. I think we moved into more of an acceptance phase. So we just pretty much treat everyone as if they have COVID. And so you do that lovingly, but you also do it with a degree of safety.
And to your original point to me was powerful, because I think it's important for the audience to realize that doctors and nurses have fears too. Like you all have an abundance of knowledge. You're the complete wattage of the brains on this show. Light up 3 American cities. All of you are brilliant, absolutely. But even with all of that brilliance, Dr. Kwanzaa, you really highlighted this for me. This is what I got from that moment you just gave me, is that fear is real. When you walk into a hospital room now, you have to think about, how is this going to affect not just the patient, but me and the circle that I'm committed to and the people that I love. Nurse Alice, I'm going to ask you a follow-up question around these lines. I'm sure you have seen a lot as a nurse in the front lines. Give the audience a sense of some of the things that you've seen that have really, affected your spirit, and how did it make you feel to be as far along in your career as you are, but to this moment right now dealing with this situation, as Dr. Kwanzaa said, a situation that you probably never thought you'd have to deal with.
Right. So working in the emergency room, you never know what's going to come through those doors. So we're always in some state of readiness, but we've seen it, we've done it before, we got this handled. Now in this state of COVID-19, the way that we have to operate is so different. So if someone usually comes in, it's all hands on deck. We're working together to help take care of someone. And now we have to take an extra step of precaution and think, you know what, I would normally just jump in and help help is like I would, but I have to put on all of this equipment and this armor per se. And that, while it's for my protection and for the protections of others, there's a part of it in me that just bothers me, because I know time, what we say in the medical field is time is tissue. The sooner we can get to just jump in and help help is like I would, but I have to put on all of this equipment and this armor per se. And that, while it's for my protection and for the protections of others, there's a part of it in me that just bothers me, because I know time, what we say in the medical field is time is tissue. The sooner we, like there's a little bit of a delay in having to put on all of that armor. But something I would say that has to probably disturbs me the most and is the most heart-wrenching is when someone is very, very ill. And I'm cross-trained to work in the ICU, so I'll sometimes go there. When we are seeing people who are very ill and cannot be surrounded by their friends and loved one, that actually really, really upsets me. It's upsetting me now to even think about it, because here you have someone who is on a ventilator. No one ever wants to die alone. No one does. And we don't want to see that. And so, that's the part that breaks my heart. And that's why I can't, urge among people, if you can do everything you can to prevent yourself from getting this, hopefully you're not in a situation like that, because that's the last thing I want to see. I try my best to keep families and friends connected, while they're on that deathbed, but they're usually on a ventilator, not very responsive, and there's space time and you can listen to them, but it's not the same as human touch, and it's not the same as being in there with your loved one, because you won't get that moment back.
Yeah, Nurse Alice, you just tapped into me. You tapped into something to me that is so basic and so essential. The most fundamental desire that human beings have, one of them at least, we want to eat, we want to love, we want to sleep, but we don't want to die alone. We all want someone there at the moment of our finality. And this disease is, if I heard you correctly, it's robbing people of what they have deserved. They've earned after a lifetime of giving and sacrificing and loving. This disease has robbed them of the last honor that they have earned, to have their family and community there. And then there all of you are, Dr. Kwanzaa, Dr. Noel, Nurse Alice. You are all taking those responsibilities and those roles of standing there while people take their last breaths. Dr. Noel, I'm a similar question, because this has started off richer. This started off richer than I thought it was. And so I'm going to ask you this: what has been the overwhelming feeling that you have felt outside of the medicine, just the human contact? What's the overriding feeling or feelings that you've had to process through in the midst of this COVID situation?
The most overwhelming feeling would have to be fear. Some of the same issues, not being able to be there for my patients the way that I'd like to be, and also having to put on those additional hats. So having to now be this patient's loved one, be this patient's sister, be this patient's brother, explain to them what's going on, go through conferencing calls between patients and family who are terrified. They can't see what's going on. There's an inherent mistrust in the medical system by African Americans. So they're listening to me over the phone, tell them things they can't see, and having to establish that trust with them without being able to look in their eyes, without being able to take their hand, without them being able to see what I look like, and that I may be someone that they can trust and lean on. Dealing with nursing staff, and especially in my emergency department, a lot of times we're single coverage. So having to be that one person who is calm when I know what my anxiety level is, but I can't let that show. You can't let that come out. So having to be the constant in a storm, just as was mentioned before, yes, it takes more time to get into the rooms, but now you're also having to say, okay, who really needs to be here? What can I do that someone else usually does? Do I really need to call lab to draw this specific blood value that I've been trained to do? I can do this myself. The humility of, if you are working with another practitioner, who's best to do the job? Who intubates more? Who puts the breathing tubes down more often? That's the person who needs to do it. So it's losing your sense of pride at work, and also kind of honing in on the sense of community with those that you work for while being there for the patients. It's a medicine I've never practiced. It is humbling, it is exhausting, but honestly, it is fulfilling too.
Some conversations that I have on this show are good, but some conversations I have on this show, they become sacred. And that's kind of what this one just became. Because we're standing in a very significant place, as I believe the audience is getting to hear from people who have an intuition and a sensibility, of a knowledge about what's going on that most of us who are quarantined in our homes don't get to experience.